तो इसमें अलग क्या है?
कोल्ड स्टोरेज डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
एक्चुअली इनको डायबिटीज है। नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ, सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स, अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Good morning, Apollo family. Do you know that an average person spends up to 90,000 hours at work? And what can one do if the work environment does not support positive work practices? What are the stress triggers that can challenge mental health? Let's talk about work-related stress and mental health in upcoming episode of Apollo 24/7's Health Hour. Today, we are bringing you Apollo's consultant clinical psychologist, Dr. C. Manjula Rao. Join us in the live session today at 11 a.m. and ask all the questions related to work stress. See you there.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaste, Namaskar, and welcome to Apollo 24/7's Health Hour. Health Hour is a show which is designed to bring you Apollo experts to your doorstep every week. We see you through this online platform where we bring you an expert to the live session. You can ask all your questions in the YouTube chat box. You must be watching this on various other platforms like Facebook. But I request, if you want a solution and an answer for your query, please type your query in the YouTube chat box only. Today we're going to talk about impact of work stress on mental health. Shortly we'll be joined by Dr. C. Manjula Rao, consultant clinical psychologist from Apollo Hospitals Jubilee Hills, Hyderabad. So we are waiting for her and we will be joined by her very soon. But let me also tell you, but on the show you will get a chance to win prizes from Apollo 24/7 by participating in the health quiz. 3 questions I'm going to ask towards the end of the show, and also towards the end of the show we are giving away gift coupons and discount vouchers. Make sure that you get them and get benefits out of Apollo 24/7. All right, let's start the show by talking about a wonderful initiative which is called Saving a Child's Health Initiative, in short, which is called SACHI, free pediatric consults for every child in need. SACHI, in association with Apollo 24/7, is on a mission to make quality healthcare accessible to underprivileged children at no cost. This will benefit children across India who are underprivileged. More than 10 plus pediatric specialties who are renowned Apollo pediatricians are participating in this program. Scan the QR code which is on the screen. You'll get to know more about it and spread the good word. All right, time to talk about our very, very relevant topic of the day, impact of work stress on mental health. Let me invite Dr. C. Manjula Rao, consultant clinical psychologist from Apollo Hospitals Jubilee Hills, Hyderabad. She has experience of 6 years in dealing with this. She specializes in neurodevelopmental disorders, neuropsychological disorders. She's held workshops on occupational stress, emotional health of women at workplace, and dealing with grief. Her research and publications include evolution of transgender diagnosis from GID to gender dysphoria, enuresis, and psychological factors. It's a privilege to welcome Dr. Manjula Rao. Namaste, Andy. Welcome to the show.
Namaste. Good morning, all the beautiful people. Thank you for having me this morning with you. And looking forward to this, speaking on this topic. As you said, it's very, very relatable. And most of us have been through this at one point of time or the other.
Perfectly said, ma'am. All of us need to work. And while we are working in our competitive world, I think we have deadlines to our success or net worth. Everything is depending on our worth. So, how do we deal with this? Let me start by asking you, why is this topic very important or very relevant in the current times? What is the impact of work stress on mental health?
Yes. As we see, as adults, most of our time is spent at work. And the experiences we have at work is what defines our general well being. If the experiences at work are negative, then we go on to develop stress. And being in this stress for a long period of time leads to burnout, and then depression, anxiety, suicidal tendencies, self harm behaviors, and then it extends to family also, where there are marital conflicts. Children develop behavioral problems because parents are too stressed, and not enough stimulation is there at home, no shared activities with all the family members. And then it goes on to develop other problems like eating problems, sleeping problems, diabetes, irreversible hypertension, blood pressure, and cardiovascular diseases. And more than everything, the company is at loss because of attrition rates. Many people leave the company, and there is absenteeism, and all this negatively affects the productivity. And see what a huge impact on economy in the end.
So finally, it boils down again, to take care of one's mental health is a priority of an employer. It is also
Exactly.
very important. So let's quickly say, what are the symptoms of work-related stress? I know that we are stressed at multiple levels, but I want to pinpoint what are the symptoms that arise from work.
Okay, so when a person is going through this work-related stress, it usually starts with a emotional disturbance. There is, anger outbursts for small things. The person may get irritated. There is frustration. The mood is irritable, and then there is, it goes on to develop apathetic mood. That is, I'm indifferent to whatever is happening around me. I become emotionally exhausted. And then I view the value of my work in a very skeptical manner. Like, what am I doing? I'm working for peanuts and there's no meaning in my work. And slowly I lose control over many areas of my work. And the symptoms to watch out for, as you said, would be this irritable mood, sleep problems, insomnia, and then either I put on weight, my eating is disturbed, and then I lose interest basically in the activities which I was enjoying before. Now I no longer enjoy them, and I become isolated. I don't like to talk to others. My behavior becomes more, withdrawn. These are a few symptoms we can look out. We know the person is having stress.
Right. And to also to understand that each one's work is very different, work environment is very different, how we work to earn our money is very different, how much we earn for the same work is very different. So, what can cause stress? What are the reasons at work that can cause the symptoms or signs or the stress related issues?
Yes, so there are many ways to look at it, Jhansi. But we'll stick, for the moment, I would like to stick to the view of WHO, World Health Organization, in its 2005 and 2017 document on mental health policies and programs at workplace, which is available on internet. So in this document, it defines workplace stress as, a response people may have when they are presented with the work demands and pressures which do not match their knowledge and abilities, such
Okay.
that it becomes a challenge in their ability to cope. And the interesting thing is, they have elaborated this definition to some extent, saying that these pressures and work demands are created due to poor work designs, poor work systems, and poor management. Which means people don't know what work am I supposed to do. The goals are vague, and how much am I supposed to do, and how am I supposed to do.
While you were talking about this is a very, very important statement. So, are there any guidelines to prevent the impact of work stress on mental health from the organizations or employers? Are there any specific guidelines?
Yes, of course. Again, in the same document, I would be referring the document on mental health policies and programs at workplace, 2005 and 2017. So, in this document, they have come out. WHO has come out with very clear four-step guidelines, which most of the workplace wellness sectors today use. The companies which are called EAP providers, the employee assistant providers. So these companies follow these four guidelines, which is number one is analyzing the data. What do we see here is we are supposed to actually find out how many people globally, all over the world, suffer from work stress. So the data somewhere is between 55% to 75%. Then come down to India. How many people in India actually suffer? So the data is for 48% exactly, 48% to 75% again. Now,
Huge.
then it is. Okay. And then we translate this to our company now. Let's translate it to Apollo now. And now we are going to run a baseline assessment where we get a picture of how many employees in my company are stressed. I mean, have this work related stress. I divide it into different departments, say the security force, the F&B force, the housekeeping force, the nursing, the junior doctors, the consultants, the residents, all this. We divide them, categorize, and then find the stress in each department. And then the next step would be, after we have analyzed all this data, we have something to work on now. We develop a policy. In simple words, developing a policy is nothing but setting a goal. Now, these many people are severely stressed, moderately, mildly, or this much is the stress in the company. We are going to reduce it over a period of 3 months. When we assess again after 3 months, we expect the stress to go down. And then when we develop this policy, we go on to the third stage, which is, developing a strategy. Developing a policy is just a goal setting, but developing a strategy is how are we going to attain that goal. So this involves actually the involvement of many stakeholders, the team leads, the managers, the HODs. And then it might be like a big program, like conducting a very big ceremony to launch this program, or it can be as simple as sending a WhatsApp message or an email saying, all of you gather here, we are going to start a program like this. And once we have a strategy in place, the last step would be to implement the strategy, carry out what we have thought of doing in the way we thought of doing it, and then evaluate it. Have we done it properly? What are the areas we could improve it, and what are the areas we can, improvise it, translate it properly?
Right. So, yes, ma'am, before we continue our discussion, Mohit has mentioned questions will be taken from the YouTube as well. Yes, I'm going to start the chat right now. So I request, a lot of people are asking general questions. Any work-related stress questions, please go on and ask. I'm going to take up YouTube chat questions. Thanks, Mohit, for coming and joining. So we are going to take questions. Then I will also start taking questions. Ma'am, the first question that I want to talk about is Rahul Garg. Rahul is asking about a non-performing partner in business. How do I deal with this? This is causing stress.
All right. So, Rahul, it's a great question. Thank you for asking this question. So, in business, when we come in partnership, so mostly it is our personal choice, isn't it? It's my own choice that I have volunteered, or I have decided to that I will do business with you. Now, after we come in business, we realize that this person is not showing that much of interest as much as I'm showing, or this person is not, performing as much as I'm performing. I'm working hard and he's enjoying the benefits, so she's enjoying. All right. Then we need to have a fair conversation. Look, this is how it is. I think let's share the burden of this work and then allocate the work. Both of you, both the partners can sit and set goals, and how to achieve those goals. I will look into these areas, you look into these areas, and let us come out with methods of looking at it. Now find out if this partner has the ability and the knowledge of that work. First of all, sometimes we do not have the ability, but we want to do that, and that is a time we can help them understand in a very empathetic way.
Right, right. So that's nice, ma'am. Thank you so much for answering Rahul's question. Next is Sheraz Malik's question. He's asking, will depression have an effect on communication and understanding issues?
Yes, if you have observed it, it's a very good observation, Sharaz. With depression, what happens, there are communication issues because, we reduce our attention and concentration levels. Mostly, when a person is in depression, we don't follow, or we have to pay more attention to the other person communicating. That is one aspect. Another aspect is emotionally, I don't want to go and talk to anybody. I don't have the mood to talk. I don't have the inclination to go and connect with another person. I become withdrawn, isolate myself. So that is one thing which makes us not interested in communication when we are depressed. Rightly, you've observed it.
So there must be ways to manage this, because Hemanta Sharma is asking this question. While depression, anxiety, and tension are incurable, what are the ways to deal with them on a day-to-day basis?
Yes, yes. We cannot say that they are completely incurable. All right. Even if we look at it as incurable problems, we can always find ways of managing those problems, dealing with those problems in a better way, and so today the latest treatment in psychotherapy, psychological treatments, is mindfulness based therapies. So mindfulness is one powerful treatment that helps us to develop self realization, We look at our behavior, our emotions in a non judgmental way. The moment we feel anxious, we become aware that we are anxious. And the moment we look at the problem, we have paid attention to the problem, and to a large extent, the problem goes away.
Yes, ma'am. So also, because we're talking about this, let's also talk about daily things that you can do to reduce stress. Would you want to advise any practical ways to deal with this?
Yes, there are many, many methods of dealing with stress, but some of my patients get angry, in general, not with me or with any doctors. They say the moment we have come to you because we do not have the motivation to do anything, we don't want to go for a walk. We don't want to involve with the family activities. In fact, we don't want to do anything. Why are you advising us to do that? Right. So when a person is in that state of no motivation at all, cannot put any extra efforts, for them we would come out with a very, very simple technique, that is the deep breathing exercise. Breathe through your nose for 4 seconds, swelling your belly. Let your belly come out when you breathe in, and then breathe out through your mouth as though you're blowing a candle, which is called pursed lip breathing, for 8 seconds, sucking your belly inside, breathing through your nose and breathing through your mouth out for 8 seconds. Yes. Now, what does it do? Well, you're communicating with your brain that you are safe and you are relaxed. And then your brain, starts doing what it has to do. It produces the chemicals, what is needed when you're relaxed. Okay. Instead of producing the chemicals when, the stress chemicals all the time, now and then your brain gets to know that you are relaxed. Now, this breathing exercise doesn't need any effort from you. Wherever you're sitting or lying down, you can do it. Whatever actions you're in the middle of, you can do it. You don't have to do it for half an hour or 5 minutes or 2 minutes. You just have to do it once or twice. Breathe in once, breathe out once or twice, and do it whenever you remember, probably once in an hour or twice in an hour, etc. So these kind of many exercises are there which do not require extra time and effort from you. When there is no motivation, please do it. Our aim is not to reduce the depression, but our aim is to increase our relaxation. Okay, increase our positive behaviors. Thank you.
Great. So अंकित शाह जी पूछते हैं ADHD के बारे में, which I think is not possible to answer on this platform. Dr. Manjula Rao can be contacted on Apollo 24/7. We have left a link of hers. So Akshit Shah, I'm sorry, Mr. Akshit Shah, ADHD people, can they live successful life? Any treatment? Please answer my question. That's repeatedly he's asking. So would you want to? I don't think this is the platform, ma'am, but would you just want to take a minute or two?
Yes, yes. Some questions may be beyond the scope of this session today, but definitely your questions will be taken. The previous question also, probably the person has asked that question because they have seen my specialization as neurodevelopmental disorders. Yes, we deal with ADHD children, and yes, a lot of help is available for this neurodevelopmental disorder, which is attention deficit hyperactivity disorder,
Yes, ma'am.
where we assess the child how much of ADHD he has, whether it is mild, moderate, or severe, or does he have any other illness along with it, comorbidities we call. And based on that, treatment can be given, and beautiful therapies are there. Go ahead and take the treatment. And coming to the next question, yes, ADHD is manageable. Again, if you have ADHD, that means you are a highly creative person. It has many, many positive things in it. Okay, they are very lively people. They perform more than the normal person can do. In fact, there's even a quotation, how much of thinking I have from the time I wake up till my breakfast, the whole day. The ADHD person can do all that thinking in that little time between waking up and breakfast. So that fast is their brain. So there are many mindfulness based therapies for adult ADDs or ADHD, which you can follow up. And please do connect with us. We work on that extensively in Apollo as well.
Yes. So here's a question from Sai Srujan Paspuleti. Can you please give us some tips? No, Sai Srujan's question is, in a company where we cannot choose our teammates, in that case, how can we deal with stress?
Yes. So here, the company makes the decision of who you're going to work with and how you're going to work with. So you need to become aware of this. This is not my choice. They have made a choice, which means I may have a bit of, the initial interpersonal problems, initial stress in rubbing shoulders with the new people. But the choices I have made to work in this company, the choices I have made to do this kind of a work. Now, based on those two things, we look at this problem now. What are the exact problems in working or not being able to choose your teammates? We need to identify those problems. And once we identify, we have to develop a little assertiveness and find out how we exactly communicate. Look, this is my problem, and before you communicate, we have to see whether it is a problem that can be managed by you, or it needs to be, told to your boss, and then go ahead and convey it in the most assertive manner, such a way you don't hurt them and you don't have to bear that also.
Yes, ma'am. Very interesting question here, ma'am. I would want to take up. Bhanu Prakash is asking: is the work stress happening only due to work at workplace? I also believe that external stress can also impact our work and reduce the productivity, which can cause stress at work. So, how do we manage this? I mean, the work-life balance, personal life and work balance.
Yes, yes. This is a beautiful question. When you look at it, it's very comprehensive. So, in a same organization, it is not necessary a person in the same organization, same team may not have the same level of stress what you are going through. So, yes, workplace stress is dependent on our individual psychological factors, on our personality factors, on our familial factors, all those things. So, when we look at it, if we say the stress is only because of work, which has blurred our boundaries of personal time and personal space, because that is what happened during the COVID times. We were working from home, so office space and home space was same. So if it has penetrated into the family because of that, definitely we need to look at it from a different angle, that coping is not good, the family coping is not good, it is because of the work stress. Then I start my therapy as a family intervention and do whatever is necessary. But even after doing that, the stress is incredible, you cannot bear it anymore. I think it needs an EAP, that is employee assistance program, to be enrolled in that and working towards managing that stress. But the important part in this question is that yes, it depends on our individual factors also to a large extent. Thank you.
Right, ma'am. In connection with the same question, Karan Motwani is asking a very important, his observations are very, very important. I love my work and I enjoy my work, but sometimes office politics have a great impact on me, and that anger I express on family and friends. How do I control and maintain my mental health?
Yes, this is what is happening with many people I have come across. So to see the simple example of this, it's a kind of a defense mechanism. I would not go into the detail of it. This is a psychology jargon. So, which means to say, I'm not able to take out the anger on that politics and those people. So, I come and take out the anger on something which is very, very weak. Like some people bang the door, some people throw the vessels loudly, and here we see somebody shouting at the family members, because no matter what you do, this family is going to bear you, or they may not be as powerful as you to fire back at you. But remember, inside they are feeling very, very hurt, because you just shout at them, take out your anger, and you forget about it. But words that you have spoken may deeply hurt them, and that may later on reflect in the quality of your relationship with them. That's not the right thing to do. Become aware that you are not liking this politics. Develop any other way of dealing with this problem rather than shouting at people. Yeah.
Yes, yes, ma'am. So one common question from a lot of people who are asking about anxiety, बहुत घबराहट होती है और we are not feeling okay. Chandan, Deepak, Imran, Sadashiva, a lot of people are asking about chronic stress, घबराहट, tension, नींद नहीं आती है, depression में है. So when people identify that they are going through something, what do they, where do they go to? किसको पहले वो बताए कि they are not feeling okay and they require help?
Right. So, yes, so whenever we have a problem, a mental health problem, there is the first thing is we feel distressed. Something is going wrong with me. I'm not happy. I'm not able, I was not this person what I was before. Yes. So, being exposed to chronic stress leads to burnout. Burnout is emotional exhaustion. I feel numb. There's no more feelings left in me. I don't value my work. There's a feeling of cynicism, and there is a feeling of reduced personal accomplishment. I don't feel that I'm able to do anything. I feel I'm like incapable of doing things. There's reduced self-confidence and self-esteem. Yes. And if you feel like this for most part of the day, and if you feel like this for many days together, and if it is for more than 2 weeks, it is time you seek mental health support. Okay. You talk to a professional. You can go to a clinical psychologist who is not a medical doctor and who will help you build an insight or awareness into the problem. And what he or she will do is stick to talking therapy. A talking therapy is many forms of therapy, like one session of supportive psychological counseling, and then a few sessions of solution focused brief therapies are there, or a few sessions of CBT, cognitive behavior therapy, for stress, anxiety, and depression, which is the most popular treatments. And now we combine them with a little bit of mindfulness also, so that they feel better quickly. Now, if the problem is too severe, if the problem is so severe that you're not waking up from your bed and not going to office at all, your functions have become impaired, not talking to anybody, not taking care of your health, no bath, no brushing your teeth. If it has become so severe, I think medicine can help a little. And the right person would be to go to a psychiatrist along
Right.
with a psychologist. Yes.
Right. So here's another question from Devia, Karishnika Devia. Women and work. Can you please share some tips to handle stress for women, especially at work?
Yes. So women's roles, as we are seeing, all of us around us, have changed. Drastically it is changing day by day. And depending on that, many other things that revolve around this are also changing. For example, if you see, one of the effects is relationships are suffering a lot today because women have more choices to make. They understand we have more options. We are independent. We don't have to be in an abusive relationship or a relationship where there is no respect. So these are some of the effects when we look into the society in a broader perspective. Now, coming to work, so a woman working, which means it also may put stress on the man, where he has to, the gender role, the way the man is brought up, a boy is brought up in his house as a breadwinner, but here the women also is equally doing the same work, which means a man has to, some of the men, not all, so they have to relook, into their roles and see how best they can accommodate into this new gender definition, this new role that is expected of them. It is only when this new role is not accommodated properly, then something happens which is called role conflict. And this causes problem for the women, where she has to take the burden of, working as well as being a homemaker, taking care of kids. But most women around us we see are doing it very, very successfully. It is only some time late is left where all of us would be managing it very, very well. Again, looking at individual characteristics, becomes important, the way women deal with stress.
Yes, ma'am. Ma'am, next is Kartu, who is asking about night shifts and sleeplessness, dark circles, dry eyes, and not able to concentrate. Night shift is not just Kartu's problem. Most of us do works in the night where I think physical body is also exhausted, and then there's workload which is also there. Is it a deadly combination, and how do we deal with this?
Yes, it is. But then again, Jhansi, I come back to my previous statement. It is a choice that I've made. I've made this choice to work in the nights because that was a lucrative job, probably, or the only job available for me at that time. And so I could compromise. I could say, yes, I can do it. Let me go and work in the night. But you're not the only person. There are hundreds of people, as you said, who are doing this and who are managing to some extent in a very well manner. So probably you can compensate that by sleeping during the morning time when you return from office, as many people are managing, and look out for activities that cause relaxation in you. When a person is suffering from sleeplessness, it means that the person has been sleeping a lot during the day, or that. So you may ask me, no, the whole problem is sleeplessness. How can you say that we've been sleeping a lot? By sleeping a lot, I mean not being in the present moment. Either you're worried about, your future, or you're constantly thinking about something negative that happened in the past. So you're constantly living in the past or the future, but never in the present time. Okay. And this state of fear and anxiety actually tells your brain that you're in danger. So when any human being is in danger, are we going to sleep well? No. That is how we are designed. Whenever there's a danger lurking around, we don't sleep because we have to survive. Yes. So look at your sleep as a problem with anxiety, the overthinking or the worry or the fears that you have. And again, here mindfulness helps a lot. Meditation and sleep has a positive correlation. The more meditation you do, the more better sleep you have. That's what studies have indicated. Try doing that.
Wonderful, ma'am. Thank you so much. Because as an actor, even I get to work in the nights and I try to manage sleeping in the day, which again is not fulfilling or satisfying. And I tend to oversleep for than the prescribed hours. And this is something that you have given me as a tip. I should manage that as well. Thank you. Karishma Mumtaz is asking a personal question where she has to attend a surgery very shortly. She is anxious because of general anesthesia. So general anxiety because she has to face a surgery. How do you want to address this, ma'am?
Great. So I would tell her not to, feel frightened at all, because the surgery team themselves will give them a very beautiful supportive counseling is given. But as a psychologist, if somebody comes to me with this problem, I would say that, we can go over the whole procedure in our mind. We can sit and think about it once, what all things they will be doing. Also imagine, visualize the people around you. We have something called hospital related anxiety, which most of us have. Normal person, let's say, I am admitted in a hospital. Okay, let me not take my example because I think I'm so used to the hospital, I may not be scared. Somebody else, if they are admitted in a hospital, more than that, this person has never been anxious before. More than the real problem, this person becomes anxious looking at the uniforms of people, looking at the hospital curtains, looking at those glucose stands and the hospital equipment. And all this is related to hospital anxiety. Now, pre-surgery fear is also one such hospital related anxiety. You can sit quietly and visualize the whole thing, the people around you, the operation theater, what the doctor will be doing to you, and what the procedure might be, because they'll explain everything to you. And once you go over this again and again, I think you will become familiar with it. When we become familiar with something, it no longer scares us. The fear becomes less. Okay, try doing this. This is one simple hack that you can try at home. Okay, so the
Karishma
doctors,
Mumtaz,
yes,
she'll
doctors have
have
to.
surgery. Look, sorry, ma'am. I know that technology is
Yeah.
interrupting. Yeah, go ahead.
So regarding the surgery, I think it is the doctors who have to worry, not the patient at all.
Good one. Good one. All right, ma'am. So Karishma ji, have a great surgery and जो ये anxiety आप पार कर लेंगे और surgery करवाएंगे, आप सही सलामत और great health के साथ वापस आएंगे. That's even more an exciting news for all of us. All right.
Exactly.
Next question is from the learning space. I don't have the person's gender or name here. I cannot understand that I'm stressed, but I have developed all the symptoms of stress. Fibromyalgia detected, and I'm taking medication, Stalopam Plus, Zolfresh 5. So there's no, that somebody doesn't identify stress, but have all the symptoms of stress. Do you find such cases around in your clinic, ma'am?
The physical problems, probably stress has manifested into these physical problems of muscular tension, the pains and aches which are unexplained, sleeplessness.
Correct.
He's taking Zolfresh probably for sleeplessness. So those are the few symptoms that is identified now, isn't it? There will be symptoms, definitely, but maybe we are not aware of them. We are not aware of all the symptoms of stress. That is the reason we think we couldn't identify.
Right. So management, even though you don't feel the stress, but it's important once it's manifested in the physical form, it is important to do de-stressing activities that you have mentioned earlier.
Yes, exactly. We have to, we can start with simple breathing exercises, or meditation exercises, which doesn't require any effort. We can try doing this. These are very simple. It doesn't need any effort and motivation on your side.
Correct. I think I'm one such person who never feels stress as in stress. जैसे learning good friend there, somebody has pointed out there. My friend, even I am in the same category where I don't feel the stress which is stressed in the head, but in the body, yes, there are multiple ways that the stress shows up, and I go back to my yoga, my breathing, and my meditation. So we are all constantly bombarded with different kinds of work. Daya Rathor is asking this question, ma'am. Since 3 years, Daya is facing panic attacks and depression. He was under medication, Zaptra 25 and an Axupra Plus tablet. But now I have transferred from Bihar to Andhra Pradesh for work. Now again I'm facing panic attacks. So do you think this is panic attacks come again due to stress at work or change of place?
Yes. Uh, Panic attack actually has very deep roots. We think it is a reaction. Now, because of COVID, I got panic attack. Because of work, I got a panic attack, or because of a change of place. Yes. So this is a deep-rooted fear which has its roots right from childhood. So there are many theories supporting this that says if we have been exposed to traumatic life events in our developmental period, that is 0 to 17 years, so we are prone to these kind of attacks. Such people were highly dependent on their primary caregiver, and now when they grow up into adults, they become dependent on fear. So, whenever there is a crisis or a life threatening situation, any change happens in life, the first thing we depend on is fear. We want to worry, we want to, adopt all those fearful behaviors. So, rather than looking at some event that has happened recently, we have to go over and uproot this whole tree rather than, just cutting the top branches of it and saying that I will do meditation, this and that, so I can heal with my panic attack. No, we need to go deeper than that and see where this behavior has actually happened for the first time. Because it's not the first time, it would have happened as young adults, at adolescence, and then go back to it and look at it. That will help us actually to deal better with panic attacks. And I would always advise you to talk to somebody, seek help, because there's beautiful therapies for panic attack.
Yes, ma'am. While we're talking about adults, I think Shreya is continuously bombarding with only one question. She is desperately looking for an answer. I know that this is not the platform, but very briefly, I would want you to address this, ma'am. How should children deal with severe depression and anxiety? I know
Yes.
that this is not the platform here. Shreya, just to mention that we cannot go more than beyond what time permits, but Dr.
Yeah.
C. Manjula can be contacted on her 24/7 virtual platform. Ma'am, please continue.
So, this is not uncommon. Childhood depression and anxiety is not uncommon. Again, one small thing you can do in the house is start shared activities where all the family members can go for a walk, let's say every day at the same time. Shared activities have to, it is activities for others, but for you it is a treatment. So how would you do a treatment? Same time every day. Let's say at 9 o'clock you decided to go for a walk today. Tomorrow also it would be at 9 o'clock, and it should be regular even on Sunday and holidays. And let it be a silent walk where nobody is talking to anyone, but the whole family is together. In some way the child feels it's getting the attention of parents. Or you can come out with more interactive activities, like for this child would be playing carom board. So this also can be a shared activity where all the family members are playing, and the father and daughter can be the team, mother and son can be the team, that way. Or it can be another activity where father and daughter are cooking some meal, or once a week both of them engage in some activity. So engagement can help reduce depression in your child. If it is too severe, please seek help.
Yes, yes. And this is not enough. Talking about this platform is not enough. It requires more in depth analyzation and getting more information. Please do contact Dr. Manjula for more information. Well, here's a question about, will alcohol be a solution to release stress? PBM has asked.
Okay, that's a wonderful question, which brought a
Really?
smile, to everybody's face. Okay, all right. So as we know, yes, most young people, they say we drink because the moment you drink, the way it reduces your anxiety is amazing. Yes, unfortunately, it is not the best solution. It may give you the momentary pleasure, but it is not something that will heal you permanently. So, what happens now again when you feel stress? This experience will make you go and drink again. And now, this time when you drink, your brain wants more of it. You increase your tolerance also towards the substance. Probably this is one way of solving the problem, a very, very primitive way of solving the problem. Of course, you are on the ladder of solving your problem, but this is a very low step. I think the first step of the problem, rather than facing depression and being alone, going there, you're drinking. But also think of other ways, other better ways, because this is maladaptive. They say it can spoil your liver and all that. That's the reason I'm telling you. So there are also other ways which eventually I want you to look at. Thank you.
Yes, ma'am. Thank you so much. Well, to all the viewers who are watching and who are trying to seek out help, may I make a small request to all of you? I am looking at your questions. I'm trying to get the best and the relevant questions out to ma'am because of the paucity of time. And if you bombard the questions like this, I'll not be able to take up your questions. I request you to type your question once and wait for the answer. I'm going in an order so that ma'am can give you clear answers. Well, ma'am, here's Gangwani's question, who is talking about chronic stress. And there is also Sadashiva who is asking about, if there is stress which is identified and which is chronic, how do you deal with this?
I think we have answered this question before. Well, again, I would like to go on it. Yes, chronic stress is. See, if you have been exposed to chronic stress, that leads to burnout, I said, and ultimately leads to depression. I think if you have realized you're in stress, and for most part of the day your symptoms have been there, and it has been there for many days, and if it has been there for more than 2 weeks, it's time you seek help immediately.
Right, right. So there are ways to reach out. And ma'am, do you still find that there is, while there is so much of awareness on mental health, we are doing mental health awareness campaigns and there's so much to do you still think that there is stigma to reach out to therapy or to reach out to a psychologist?
There is still. Uh, because that depends on the others, people who are not having any mental health issues. There is no empathy, you know.
Right.
We are highly judgmental. and stress has become more of a culture than of a problem. So it's like this, so if suppose um, like you have seen a picture, my neighbor has posted a picture with his BMW in Instagram, then it is the culture that I stress myself, work harder, and get that. So, what am I doing here? I always want to please others. So, stress has become more of a culture today than a problem. You know, that is how we are looking at it.
Okay.
So,
Okay.
I'm so sorry, Jansi, I digressed from the question. Could you just
No,
repeat
ma'am, but
it?
it's important. But it's okay, ma'am. But in continuation with the answer that you have given, Banu Prakash's question is relevant here. I enjoy my work even though I'm going through certain external stress. I'm trying to be my best to keep it unimpacted, but personally, it is quite difficult to manage. It is giving me more stress. So, this is where we come. While we say the BMW example, while I think that I'm enjoying this, I'm trying to do that. It is giving me stress, which is not manageable. I think I can relate that to Bhanu Prakash's question.
Yes, yes. But we need to congratulate Bhanu here because he's been dealing well, he says. Though he has problems, he's been able to cope well. And he says, I do not allow this to impact my other areas of work. But he realizes. So, Bhanu, it's always good talking to somebody about it, and finding out ways how else you can manage it better without impacting you. And when you say it's impacting you, identify what are the things, what are the areas that it's exactly impacting you.
Wonderful, ma'am. Identifying and then addressing it. These are the two
Mm.
important factors, and there should be no stigma in reaching out in case you require help. Well, here's Yaduraj's question. He is diabetic, overweight, and always in a fear of getting a heart attack. And if he hears that somebody has passed away with heart attack, he has panic for a long time. Is this a case of anxiety?
Yes, it is a typical case of a panic attack. This is how we start a panic attack, actually. Um, there is a, we have a model for this, which is called the vicious cycle of panic attack. So, this model says it's, there is always a trigger. It can be an external or an internal. Now, suppose he gets a chest pain, that's an internal trigger for him to think and get a panic attack that I'm going to get a heart attack. Or if it is a news that somebody died of heart attack, that is an external trigger. Once the trigger happens, then comes apprehension. They become intensely fearful, and then comes the, your body starts reacting, your heartbeat increases, your lung functioning increases, your BP rises, all those things, the autonomic arousal it is called. So it's all right, these three things are okay, but the worst thing is the fourth stage, where we start giving catastrophic meanings. It is called catastrophic misinterpretation. A chest pain, now we are going to give a meaning to it as heart attack. A stomach pain is cancer, stomach cancer. So now we have given a meaning as heart attack. I'm going to get a heart attack. Now we start panicking. Will the ambulance come on time? Or will the ambulance take me to the hospital? Or will I be stuck in traffic? Or will the doctors be able to identify my problem? Or will there be a doctor to do the surgery? The endless questions, negative thoughts that come into your mind. So, this is a form of a circle that goes on. What he's right now undergoing can be explained by this model. Again,
Yes,
this
ma'am.
needs professional help.
Okay. So Akhil Thomas's question in connection is, Doctor, how to manage sudden panic attack? Kindly advise. So what kind of help is available, ma'am?
For the sudden panic attack. Yes. The thing is, he has identified is it as a panic attack. So once you've identified it as a panic attack, there's no real medical cause for the problem, so you're calling it a panic attack. The next thing for you to do is engage in a therapy. Psychology is not emergency medicine. You put a pill and then the panic attack goes down immediately. Psychiatry can be like that. Whenever you have a panic attack, the psychiatrist will tell you, take this medicine, it will calm you down. But psychology, you have to engage in therapy. Over a period of time, you'll definitely see that you have changed in many ways. in better ways.
I vouch for that, ma'am, and I, going through grief, going through severe loss at personal levels, we've engaged in therapy, and which has helped us and family members too. So I should say that therapy should not be stigmatized and should be promoted extensively. Yeah.
Yes.
Ma'am, next question is from Funny Cartoons. नाम नहीं दिया है इन्होंने. He's suffering from depression. He or she is suffering from depression, anxiety, taking Feliz 5G. Sometimes nightmare is killing me, and I also encounter the feeling that I'm going to die very soon. Please help. So while they are taking these medications, psychiatric help, do you think psychotherapy also will help them?
Yes, there is lot of research evidence we have today that says the combination of these two are, very, very effective. And not only that, they reduce another episode of the psychiatric illness.
Yes, yes, ma'am. So Pradeep Das is asking, 27-year-old, I have no job. My father falls sick nowadays and full family responsibilities. In the meantime, girlfriend also breaks up with me. So a lot of pressure has come upon me. I'm not able to deal with this. I understand that once you are in a problem, everything else also manifests. Either it brings a problem or you feel that there's a problem. How can we help this young man from these issues?
I feel very sad for him. A group of problems have struck him at the same time. The girlfriend breaking up, that's a very, very sad thing. And then father not feeling well. I would only say, as a fellow human being, all I can do is, right now, feel your problem, what it is. Um, then I don't know if you will take it wrong, but out of concern, I would say it is better you meet a psychiatrist and they'll advise a very mild dose of antidepressant for you to walk through this tunnel. That's all, just for few days. And once you have come out of this, I think you will feel better, because these are stresses which are there in your life, and your problem is a reaction to these stresses. You may not be a depressed person, but right now that little help can help you coming out of this tunnel.
I think Hellopedia इनको भी same advice हो जाना चाहिए, because they've been writing too many times. Best friend is avoiding me, unable to avoid the friend because I have more memories and it's giving me stress. So friendship or relationship and stress, I think the same answer is applicable to them.
Yes, yes, yes. When somebody decides
Yes, ma'am. Please continue. Please.
somebody decides to leave you or to avoid you, that is not in your control, isn't it? And it is not easy for us to leave it also, because we say, like how you're saying now, what will I do with all the memories that I have of you? So somewhere we are obsessing, I feel, on that person, that I want you to be in my control, I want you to talk to me, I want you in my life still. And though the other person doesn't want, that's not in our control. I think letting go, which is very, very hard, is what is needed here.
Well, ma'am. Important question and a quick question, quick answers if possible. Last three questions I'm going to take, ma'am. PWDT is asking, can excessive screen time cause some mental issues?
Very much, very much. Excessive screen time is prolonged period of not doing productive work or engaging with the screen is a form of addiction, actually. Like other addictions, this also is a form of addiction. This can increase your anger. It can impair your other functions a lot.
True, ma'am. And next question is Tekeshwar Kunjim Kunjingbam. Tekeshwar, and that's if I'm not spelling them wrong. My child is taking Nexito Plus as advised by doctor. Will this affect his studies?
So your child is put on an antidepressant, or maybe he was anxious. So the doctor who has given this to you, you need to have this conversation with the doctor who has prescribed this. Okay. And I don't think it's a big deal of a drug to produce lot of side effects. Okay. And have a talk with your doctor definitely on this.
Done, ma'am. Swati Lohia ji is saying I'm suffering from insomnia, and on top of it, I have a fear of sleeping as well. I go through sleep paralysis frequently. Please suggest.
I think we've answered a similar question before, why people don't sleep. Okay. And sleep paralysis, what is sleep paralysis? That you get a dream as though you're running in your sleep or something is chasing you, but then you're not able to get up. Your hands, legs, your limbs are actually freeze. So if you look at sleep paralysis, it is a protective phenomena. Imagine I get a dream where somebody is chasing me, and in my sleep, I get up and I start running. There is a possibility I may hurt myself and injure myself, isn't it? So this is a protective phenomena. Our brain paralyzes us and helps us continue to sleep. And after some time, we wake up. You don't have to be afraid of this experience. Thank your brain for this, actually.
Wonderful way to look at it, ma'am. Thank you. Well, Karishma Gangwani ji and funny cartoons. Ma'am ने आपके questions answer कर दिए हैं. You will require some kind of, if you require some kind of professional help, she can be contacted on Apollo 24/7. Ma'am, thank you so much for joining us and on this Sunday. And can I ask you for top tips to managing work stress?
Yes, the top tips would be, having a very close knit family, having lots of family activities to be done so that if you're stressed at workplace, you can have a family to look back. Now, directly going to work places, I think engagement is the key. The more the employee is engaged in his company, in his organization, then there is a sense of belongingness in him. There is a meaning in his work. He sees the broader picture, the way not only he's helping his company, but also beyond that to the society in large and nation at large. So I would say engagement is very much needed. Today, the workplace stress is a stark reality that every employer and employee is facing. But unfortunately, neither of them are aware of it. Maybe because they don't have the knowledge of it, or maybe they are not well informed. There are many rules, and there are many laws in most countries, but for some reason it's not being executed, so people remain and suffer silently. Well, it is not needed. Help is available, and Apollo also provides lots of EAP activities to many corporates that are associated with it. And so I would recommend every company to have a workplace wellness sector in their organization, or at least tie up with some EAP providing companies so that you can make workplace a better, healthier, and happier places for all the people to work. Thank you.
Such a sweet message that you've ended with. Every workplace should be a very happy, productive, understanding and coping place to deal with stress. Thank you so much, Dr. C. Manjula Rao, for this wonderful, insightful session.
Thank you, Jhansi. As always, you've been a wonderful host.
Thank you, ma'am. Thank you so much. With that, let's move on to health quiz. Your chance of answering questions. Get ready. I'm going to ask you 3 questions. You have to answer these questions only on the YouTube chat. Winner's name will be announced at the end of the show. Winners will be selected at the sole discretion of Apollo 24/7 team. And if you are declared as a winner, you have to write back to us with your details at marketing@apollo247.com. Gift vouchers will be shared with you. And here are today's questions. Question number 1. Name the 2 most common types of mental illnesses. Name the 2 most common types of mental illnesses. Question number 2. Which month is observed as Mental Awareness Month? Mental Health Awareness Month. Which month is observed as the Mental Health Awareness Month? Question number 3. How much is 1 health credit worth on Apollo 24/7 app? How much is 1 health credit worth on Apollo 24/7 app? These are the 3 questions for today. Please go on, answer these questions on the YouTube chat, and I'll wait for the winners. While we are waiting for the winners, here are the discount coupons that you can use on Apollo 24/7 app. Firstly, I urge you all to download Apollo 24/7 app, where there are immense benefits, and here are the coupons for today. You can get up to 150% or 150 rupees off on first online consultation. doctor consultations direct from Apollo, you use the code first VC, and then you get 150 rupees off on the first online consultation. The next coupon we are giving away is first 3, FIRST 3, first 3 order medicines direct from Apollo, and you get 25% off on online medicine orders. All these can be used on Apollo 24/7. You have to download this app to use these coupons, and if you have downloaded, also there is Circle membership where you get more benefits once you are a Circle member. I am a Circle member and I've been using this for a very long time. Right, I see that a lot of people are answering depression, anxiety, ₹1. Wow, October, May, which is the right answer? Let's see. In the meanwhile, thank you so much, all of you, for joining on this Sunday and asking your questions, because your question is an answer for many people out there. So here's a token of appreciation for all of you. This is an exclusive code, HH247. Use this code on Apollo 24/7 app to get up to $199 off on online consultations with Apollo doctors and up to 20% off on medicine orders. This is an exclusive offer for Health Hour viewers. And I'm waiting for the winners. Let's see who the winners are. This week it is PWDT, Rakshak AR and Sukhdeep. Congratulations. Write back to us at apollo247.com, marketing at apollo247.com, and claim your prizes. Here's the next week's topic, getting back on track after childbirth. We are going to have a gynecologist and an obstetrician. Tune into Health Hour on 26 June, 11 a.m. If you don't want to miss this session or any other future sessions, subscribe and then ring the bell icon there. Turn it on and you'll get notifications as well. Thank you so much, all of you, for joining us. Take care of yourself. Do not let the stress impact you. Do all the de-stressing activities and please be happy. Thank you once again.